I'd love to talk about lifestyle. I'm going to say first that no two orthopedic surgeons' lifestyle is going to be the same. It really depends if you're hospital employed or in private practice. Currently, I operate about 2 or 3 times a week, and I'll see patients in the office about 2 times a week. I do the majority of my operations at my 2 different surgery centers, and these are same-day operations where they're in and out, patients have a joint replacement, and they go home the same day. And then I operate once a week at the hospital where I do sicker patients or revision surgery. A typical day at the surgery center usually involves starting surgery at 6:30 in the morning, so I'll get on the road by about 5:30, I'll wake up at about 5 that day. Depending how many cases I have at the surgery center will depend when I finish. At the very efficient surgery center, I can usually finish about 6 surgeries by about 2:30 p.m. On my hospital days, I'll start surgery at 7:15 in the morning, and I can only put about 3 or 4 cases on at the hospital, and I'm usually finishing around 4:35 p.m. A lot of this is due to inefficiencies at the hospital. My clinic days or office hours, I'll usually start around 8 a.m. and finish by about 5 p.m. I'll usually see anywhere from 35 to 45 patients. I'm lucky because being in private practice, I get a lot of control over my schedule, and trauma call for me is optional, so I get to pick and choose how many weeks of trauma call I want to take. I would say that most jobs probably have you on trauma call Q4 or Q6, so every 4th or 6th week. There's a lot of variability in lifestyle and practice situation between surgeries.